Welcome to today's press update for the 10th of May 2020. We have the subject matter experts here. We have Dr. Julius Spencer. We also have Lieutenant Colonel Dr. Sivali. We also have Major Dr. Gival. And we also have Director Rogers here from the ONS. We will start by asking the official spokesperson to give today's press update. Over to you, sir.
Thank you, Harold, and good morning, everybody. So, status update for 10th May 2020. Total cumulative confirmed positive cases, 307. Total number of deaths, 18. Active new cases, 16. Active cases at isolation centers, 222. Cumulative recoveries, 67. Number currently in quarantine, 2,051. Number discharged from quarantine, 1,989. So we have had 9 more recoveries, 5 from Lungi, 4 from Furabe College. And for the 16 new cases, we had done 113 tests. So in 48 hours, we have been able to do on average 294 tests. Our recoveries stand at 21.8% of the cumulative confirmed cases. And we continue to do the work that we are expected to do within the context of our public health emergency. Harold.
Thank you very much. We now go to the question and answer session. And okay. Yes. Samuel. No. Okay, Samuel. Yes. Can you ask your question, please? John?
Okay, thank you very much, Harold.
Okay, Samuel. Okay.
Yeah, so the question that hello.
Yes, carry on. We are getting you. The internet is not good. Yeah. It seems the signal is poor. We'll go to John. Meanwhile,
okay. Good morning.
Good morning,
thank you very much for putting in extra shift to ensure we get all the details we need on a daily basis. Now, 2 questions. First, I noticed the number of tests done yesterday increased. I think it went up by 20, additional 20 tests, right? Yesterday you said you did 100 tests, previous day. Yesterday 120 or more tests were done.
Sorry, John.
I'm gonna ask you.
Sorry, John, for the interruption. The previous was 181, and yesterday was 130.
Hello.
Okay, go ahead, John. Go ahead.
Hello.
carry on, John.
Okay. Now, so the test. Are you going to accelerate? Are you going to ensure that the numbers increase again? I asked yesterday, Doc, and I'm asking again because they are over 100 now. That means you have a set protocol, which means you can do over 100 tests a day. Are you going to increase that number to ensure that more results are announced? But if I may ask, what is the concern in that case? Is it that if you announce more results, that means you have to get the treatment centers packed with patients? You have the capacity to take in patients if you announce the numbers or the positive cases that will come in? That's part A of my question. Part B, yesterday I went to a community in western area of Freetown, western area, rural. I don't care to be precise. On my way, I met few young men. I don't know if that was sanctioned by EOC or the authorities, but they had a checkpoint there. That someone, based on what I was told, fled from an isolation center, and that the house he was in, around that community, was quarantined. Is that so? Is there a case? Do you have a case of someone who fled an isolation center? If that is so, isolation centers secured, do you have a way to be able to keep a track or tab on who's in the isolation center at a given point, and to be able to know that every patient is in every single day when you check in, and get to know that the patients are there?
John, precisely what community?
I don't care.
Okay.
I don't care.
Okay.
Godrich, in the western area.
Okay, thank you.
Western area, rural.
Okay, thank you. Okay. Yes, I am Lamana.
Yes, good morning. Thank you very much. I'm asking with regards to updates on the medicine from Madagascar. I understand they've been delivered. I want to know how many have we received for Madagascar, what's the quantity we've received, and when and how it's going to be proven scientifically, as Dr. Sivali said yesterday. And I'm still asking for updates on the Koinadugu case. I'm still asking. Yesterday it was promised someone on surveillance will be brought to explain, and no one was. I don't know if you have anyone from surveillance to explain on it. Thank you very much.
Okay, thank you, Lamana. Anyone in the room? Yes.
Yes, Ibrahim Samra, SNBC. I want to know if Sierra Leone will reach the peak, because following international media, they will explain that for April or May is the one they are experiencing peak, we are experiencing high cases. I don't know Sierra Leone will reach that period, because we are getting fluctuating figures. Yesterday we have high figure, today we are getting low figures. Then also the spokesman, I want you to explain the 16 new cases, where they came from.
Okay. Yeah.
So my first question is the issue about the face masks. At one point in time, I'm starting to be corrected. We heard that it's a compulsory for everybody in the central business district to put on a mask in order to curtail the spread of the coronavirus. But now we are seeing many people applying the CBDs without any face masks. I want to know if there is a law for someone to compulsory put on a face mask. That's my first question. The second question again is regards to this medicine from Madagascar. Yesterday I did ask yesterday.
Is it different from what Lamana asked?
A bit different.
Okay.
I did ask yesterday who controls the account, because I made to understand POC is not aware that the government has purchased us.
So is it different from what Lamana asked?
A bit different from what Lamana asked.
Can you tell us the difference?
Lamana is talking about the quantity. What I'm asking is the payment. If the EOC is aware about the payment, and who is controlling that account, the EOC or the Ministry of Finance? That's my question. Also,
okay, thank you very much. And we'll go to the responses, and we'll take the other round after the responses.
I thought you were going to ask the different one first, so.
okay, that's what I want to know.
Okay, can you just do the second one?
Okay, the last one that I want to ask. Initially, I did ask also about the test conducted during the lockdown and what the result of that. The test that was conducted during the 2 days lockdown. How many tests conducted, and what is the result?
I'm sure I announced it and you were here.
You still have to confirm it.
You were here. All of these gentlemen, and you were there on that day as well when I announced.
Oh, you still have to confirm
But
it.
I will do it again.
Okay, sir.
Thank you. Yes.
Yes, Dr. Spencer,
No, well, I just want to comment on the masks issue. I believe government has said it encourages everybody to use face masks. It is mandatory in a way, but it is not yet being enforced. I believe because government is aware that not everybody has a mask. Not everybody has access to a mask. I believe also that action is ongoing for people to get masks. There are private groups giving out masks. I think government has made some arrangement for production of masks. When government, I believe, is convinced that people have access to the masks, then it will be enforced. But for now, people are being encouraged to use it. I think that what's the problem at this point is that most people don't understand the importance of the mask. Even some of you in here who at times move the mask down, expose your nose, it shows that you don't fully understand why you should be using the mask. So that needs to be explained. People need to be convinced. And secondly, it is a bit uncomfortable. All of us using the mask in here now, we're not very comfortable with it. For me, my face is extra hot. You know, at times my spectacles get clouded because my breath ends up going up to my glasses. So it's not comfortable. But people have to understand why we all have to endure the discomfort. And when people are convinced, they will use it. I am convinced. So I use the mask virtually all the time. You know, but everybody needs to be convinced. So we will get there.
Thank you very much. On the 3 days lockdown, I'm sure I announced it, about 300 or a little over for the 3 days lockdown in terms of tests. I announced it here on the program. So any law on face masks, there has been a great deal of conversation around the regulatory regime for face masks. You know, in an ideal situation, we really would love Sierra Leoneans to comply without recourse to regimes that could force them to comply. We want people to comply willingly, and that is why initially and at all times we continue to talk to people to wash hands all the time with soap, to use our face masks, to maintain social distancing. But we have realized that in a wide range of areas, even when it comes to fake news, there has been the necessity for us to have some legal regime. So at least we discourage people from engaging in fake news, because when those things happen, they get the process of public education complicated, and especially for people who are not educated. It's a great deal of problem for us, but it also has wider and broader implications for our institutional integrity, for the image of the nation also. So we are deeply concerned. So with respect to face masks, yes, it's something we are looking at strongly. We think there is need to strengthen the regulatory and the legal regime around this, but we would want to see Sierra Leoneans comply without having recourse to some of those regimes, and that is what we continue to do. So for us in the communications and social mobilization pillar, we have challenged ourselves as per mandate that we do everything we could to widen and deepen public outreach. We are getting into communities, and we continue to thank you, media practitioners, for helping us to send the message and drive this message through and deep. And I think we are scaling up on compliance. We have colleagues who traveled to the provinces and have returned and are giving us encouraging signs about persons complying. They go to some marketplaces, they go to some communities, they go to some district halls. The way they see the positioning of the chairs in those halls, those conference halls, it gives us an encouragement that people are complying. We have highly placed persons, public officials who are moving. They get to some checkpoints and they are asked to come down and wash their hands with soap. And that encourages us that people are getting the message. So what we want to appeal to Sierra Leoneans about is this is in our interest. It's good for all of us, because by complying, we curtail the spread of the disease. Of course, we are fully aware that there is need to strengthen the regulatory regimes around this, and discussions are ongoing. and we'll continue to talk with the stakeholders regarding this. But we believe that public education is very important. There are people who you might want to say their recalcitrance may be a product of some conspiracy theories, but from our investigation, for some people, the lack of compliance is because of the lack of adequate information. So for some people, you engage them on a one-on-one and tell them what the dangers of coronavirus are, and they are willing to comply. And I think the more we do this and broaden the scope of our public education, we would see compliance scale up. What do you know about Madagascar Organic? We had said it yesterday, and we will continue to say it. That yes, if there has been a donation from the Madagascan Republic and has come to Sierra Leone, at the end of the day, for us at the EOC, we have to be mindful of what the experts say. It is left with the experts to make a very strong determination, and once that determination is made, then the EOC will follow along and will make sure that that decision or determination is implemented. That determination has not been made as far as we are aware, and I think that talking about coronavirus, just the same way we talk about other diseases, the experts should be leading on this. The experts would always constitute the most critical part of the operations. They should have the say, they should guide us, they should guide the public about what to do, what practices we adopt, as much the same way as they are also pretty much in touch with the WHO guidelines, because that is what the WHO was set up to do. So as we say, laudable steps that the Madagascan government has taken, and we believe that having local efforts, local initiatives will be hugely complementary in addressing COVID-19. But as far as the Sierra Leonean situation is concerned, that determination has not been made. There may be discussions around that, but as far as the EOC is concerned, that determination has not been made. Once a determination is made on whether it's Madagascar COVID-19 organic or any other prospective treatment, would let the Sierra Leonean people know about it. But it is very instructive and authoritative that the experts should speak to this issue, and that is what we'll always stand guided by. John was talking about whether somebody has escaped from I don't care. John will have to check this out today. I believe there are meetings going on, and Lamana, that's the reason why we have not been able to get somebody from surveillance, because the surveillance team is involved in a very important meeting at this point. Again, we promised by tomorrow, let's see, we'll get somebody from surveillance to come and talk about the Koinadugu situation, to know whether the Koinadugu case is linked, is epi-linked, or it's one of the things that may potentially constitute evidence of community transmission. Dr. Sibali, would you wish to?
Can I just note?
Sure.
Sorry, sir. The question that was asked, which has just been addressed by the official spokesman in respect of security around quarantine, I wish to inform the public that there is a standard operating procedure for management of quarantine, and there are institutions that are having responsibility for providing security, for providing welfare care, and for providing effective management of quarantine in terms of food supply, water supply, and electricity. There are institutions that are well captured within the SOT. When it comes to security, the Republic of Sierra Leone forces and the Republic of Sierra Leone police have that responsibility in ensuring that the outcast of every quarantine is provide security for that particular establishment. So, like already made mention, the points you raised in respect of somebody escaping from either isolation facility or quarantine facility, that is an issue that can be investigated. All of the institutions, the pillars are meeting, and I'm sure in the next brief, you'll be well updated on that particular situation. But be rest assured, around every quarantine facility or isolation facility, there are institutions that have responsibility to ensure that those places are well secure. Thank you.
Thank you, sir.
So, yes, do you want to talk on testing? Yes, please.
Yes. So, somebody wanted to know whether, since yesterday, since we had a total number of about 100 tests yesterday, and also today we had like a 20 number of additional tests. So he wanted to know whether moving forward every other day we are going to be having more tests. Well, I would not want to say a yes to that, because the reason is for the lab we report results in batch. So probably in a single day, it depends on when specimens are collected, I mean from the different, whether it's from quarantine homes or from isolation homes. So for a day, if we collect like less than 100 specimens, it is those specimens that are going to be tested, and that result is going to be released in the day. And second, what I also want to add to that is, it depends on the time. Let's say, for instance, I mean, our laboratorians are working in the field for like 5 o'clock, and those specimens are taken to the lab. I mean, definitely the turnover time for a particular batch of tests to be done is going to take at least 6 hours. So for that day, we are not going to expect that particular result to be added, even though they have probably like collected those blood specimens to be analyzed. So we'll have to wait and add to the next batch of results that will be released. So that is how the laboratory results are really released in batches.
Yeah. Yes. So I have a question here from Mr. John Conte. The capacity to take in more cases. I will emerge from the point of testing. Let us note that we have constantly expanded our capacity to test for COVID-19. At the start of the outbreak, it was only 34 that had the capacity. Within a week to 2, Connaught and the LACA lab was able to test. As I speak to you, Kenema is able to test. The Dewey Hospital, P3, is able to test. And very soon, I believe Bo will be able to test, and we want to expand testing capacity to McKinney, and if possible, we will be able to achieve testing capacity at every district. The response is decentralized, and we are capacitating the district health management teams to be able to drive this response forward. The number of tests done a day has constantly increased, and we have policies that guide testing. There is a case definition that has to be met, or an exposure history. And we are not just randomly grabbing people and testing, because we have to use the resources we have sensibly. We will test as much as we can if there is a reason to test. The capacity to take in more cases. As I speak to you, we have adequate capacity to take in more cases. By Wednesday, latest Thursday this week, we will have an additional 120 beds at the Peace Mission Training Center. You are aware that we have repurposed other infrastructure, like the Frabi College, that is able to absorb more cases. We know that Kenema Government Hospital has 50-bed capacity that will be operationalized this week. Bo is working on admission capacity. McKinney is able to admit. In fact, they have 2 discharges, so they have already started admitting and managing cases. And those discharges will be officially done tomorrow morning. I am in touch with the medical superintendent on ground, as we move forward. Potloko has admission capacity, and every district is working to have additional bed spaces for severe cases as well as for mild cases. So the capacity to take in more cases is there, adequate for now, but we know we continue to report cases, and therefore we continue to expand on our admission capacity. With regards to the Madagascar COVID-19 organic, we have been very clear yesterday. You know, if you buy motor cars, if you want tester, let me put it that way. We have people that are competent in the scientific committee that are meeting on this now, and they are engaging as to the approach we are going to use to confirm whether the Madagascar organic is better than current standards of care. It is going to be investigated. I think that is what I have for now.
Two of my questions. Dr. Sierra Leone, we experienced the peak because we are getting at 2 digits. Then also, the analysis about the new 16 cases.
Dr. Lako, do you want to speak to that?
Yes.
Oh, Dr. Lako is here.
Yeah.
Yeah, you can send it. We have in our midst Dr. Lako from the Connaught Hospital, is the infectious disease specialist. He will answer to some of the questions. Dr. Lako.
I want to thank you all. I want to thank you all on the aspect of saying whether we are reached a peak or not. Some aspect of it actually was addressed by Major Jivaru. And the reason is the tests are not done in a sequential order. And even if that is the case, because we are receiving some samples very late, we are not doing it in a sequential order. And we continue to have fluctuation in number of positive cases. But frankly, we are not going to say we have reached a peak at this moment. The epidemic is evolving. But of course, with the interventions that we are providing, the aspect of use of masks, social distancing, and other forms of infection prevention and control, we are able to flatten the curve at some point, not allowing it to go to the highest peak. This is the essence of these interventions. But we have not reached the peak, even though we have fluctuation in terms of the positive cases, which depends on the way we test and the samples that are being processed. On the aspect of isolation cases that Leader has said, certainly I will not comment much on that. But I just believe that we have for now the resources to take care of people who are positive in the treatment as well as isolation centers.
Okay, Dr.
Let me answer your question.
Hold on, Dr. Spencer will want to say something. Okay.
And just to maybe try to simplify the concept of peak for lay people like us. Now, we are talking about a curve. And if you have done any statistics, you know that you can plot a curve depending on the figures you are getting. So the curve will start down here, and as the cases increase, it goes up. Now, when it gets to a point where it is not going up any further, then you will say you have reached the peak. So if we get to a point where, okay, every day we are getting 50 cases, today we get 50, tomorrow we get 49, next tomorrow we get 51, etc. You can then say we have reached the peak. And then you see how the curve behaves. If it continues at that level, then you say it is flattening. It doesn't go any further up. It is flattening. Then it begins to come down. So the curve starts low, it goes up, it gets to the point where it stabilizes, that is, doesn't go any higher, and then it flattens out at that point, and then it starts to come down. That's what we mean by picking and flattening the curve. It is not an arbitrary thing. Nobody can tell you we have reached the peak when we have not seen the behavior of the figures.
Because we are getting prediction.
Thank you very much, sir.
Thank you. Thank you.
Yes.
That's why you're saying we are getting prediction.
Yeah, because you follow international media, they will say in May we have so amount like 8
Okay, so
Let
let
me
me
speak to that.
no, let me speak to that. You have modeling in which statisticians, mathematicians, infectious disease experts make certain assumptions and try to predict how the epidemic is going to evolve over time. The reality on the ground may not exactly follow the predictions, as it is most times the case. Picking is not about having 16 today and yesterday you have 26 and you make assumptions. It is possible that tomorrow you might have 40. But it is the average. It is a bell-shaped curve. And you can only be sure that we have reached the peak when your average or the daily variation from day to day is not changing more. And you will begin to realize, yes, indeed, I was at the peak when the number of new cases begin to constantly decline. Then you know that I have reached the top and I am coming down. So we look forward. By all indications, at the moment, I do not feel we have reached the peak. Therefore, let us still brace up and continue to work hard. It is possible that we will get more cases, higher numbers, and let us brace up to address the challenges as they come.
Thank you very much. I would ask for the comments from Facebook.
Yes, this very first one reads, it's from Live Frontier. He says, it is now clear that the capital is the epicenter of the coronavirus. To prevent other parts of the country that have not registered a case, please, for the general good of the country, lock down the Freetown environment totally for at least 7 days, if not 14 days, to stop the spread. And this next one says, it's coming from PC Awa Panabom, the 4th, and she says, have they stated all the confirmed cases coming from quarantine, from contact traced individuals in quarantine? Are any new case not associated with the quarantine or contact traced individuals? If so, what area did they come from? And Edward here says, Edward Amala says, the limited amount of tests done per day, the lesser cases we register. Is the ministry not afraid of performing 1,000 tests per day to prevent fear among the people? I believe if 1,000 tests are done, we may register over 500 cases per day. And Aliu Tommy says, can the wearing of face masks by market women be prerequisites for selling in the market? They are at higher chances of transmitting it to many susceptible people. And the next one is from Edward Belmore. He says Freetown now is the epicenter for the virus, for this virus. So why can't you people lock down Freetown as fast as possible to avoid the spread of this virus to the other sides of the country? More especially districts that has not recorded any case of as of now. I think there are so many, but those are the ones I can take for now.
Thank you very much, Precious. Okay. So we will go to the responses.
Yes, I just want to talk something briefly between what Dr. Sivali don't say and what Dr. Spencer don't say. And I see the sense in the question which John asked. So specifically, with the increased tests, if that is the case, we want for increase on a daily basis, and if that means expanding capacity at the treatment centers. I just want to follow with family to understand, say, all over the world, when we encourage we for wear face mask, when we encourage we for get social distancing, when we encourage you for the wash and alter with soap, reason make we talk this. We want to prevent the spread of the disease. But if you look at all countries in the world, even the country that we always admire, most advanced nations in the world, what we always done they look up to, say something and get the best healthcare systems. They might have the best laboratories, the best treatment centers. The reason we always they say, follow them guidelines. Now because no matter how good your healthcare system be, if a lot of people test positive, and need day for make a lot of people that go to treatment centers, it will reach to a point where the treatment center they're not able to accommodate the cases. So when experts can they use the word for flatten the curve, that flatten the curve can also mean make we try for manage we self, so this disease not spread to the extent that we get calls for let people and go to treatment center. Because certainly, no matter the number of treatment centers we go do, if the numbers come up exponentially and get to a point where we all can look at that figure and say, this is a concern to we might get to the point where we healthcare system not go get the capacity for handle them case they need. So yes, as an EOC, we're willing for do a lot of tests, even on a daily basis. Because if people are infected and the virus is spreading around, the more we do tests, the more we're able to dig up the positive cases. But what if, for example, we don't do a lot of tests to find out, say, people that are positive, we take them to treatment center, then quite a good number of them need ventilators, for example. Almost ventilators we get. So even though as an EOC, even though as a government, yes, we expand, as Dr. Sivali don't say, we don't do a lot of scoping. We intention to see if we can get treatment center even in all the districts. But that's not mean say people therefore just live their life how they want to live them and hope say I get treatment center for go. Because it will get to a point, even with the quarantines, the quarantine homes they manage, we're deeply concerned. To what extent are we willing to have EOC managed quarantines? Because definitely there are socio-economic implications. Do we have the resources to continue as much as we can? So dear me family and Adame could always talk and say, yes, we go do what we're supposed to do for expand tests. We go do what we're supposed to do for scale up capacity in with treatment centers, but una self get for help with. If we not help we for make we do the right things, if we allow all of them number and therefore go to them treatment centers, we might not have the capacity to address them. Aaron.
Yeah, thank you very much. I can see Lamana and John. So I will start with Lamana.
Thanks, Aaron. Again, I want to repeat my question. I think Dr. Sivali took his time yesterday and explained to even me to medical person. I understand, say, the medicine for Madagascar definitely gave a good trial and all that before they use it. That is very understandable. But yesterday, again, it was very clear that we paid 450,000 euro for air freight for that stuff for camp, where the EOC, the response team, was not even aware. That was very clear. Mr. Jamiu, yesterday you said you're going to cross-check to clarify today. My question again, how many, what's the quantity I'm still surprised that we can have a medicine here for treatment for people who are infected, and the EOC is not giving the information we're asking for on this. How many quantity do we have of the Madagascar treatment? How many of it do we have in country? Has it been presented to the EOC? Is the EOC in charge of it? Who is handling it? That is my direct question. Not about its use again. I've understood how it's going to be used, whether we are going to use it. That is understandable. Thank you.
Okay, thank you very much, Lamana. We'll go to Florence and then John. Florence?
Okay.
John, hold on, please. Florence? Yes. Yes. Okay. Florence? Okay, we'll go to John. John?
Yes, I'm here. Yes, I'm here.
Okay.
Thank you very much, Dr. Sivali, right? Thank you very much for the response to my question why they asked about expansion and all that. Okay, now, so another question now about the number of people in quarantine. Now, what's the standard procedure when they are put in quarantine, whether they're a primary or secondary contact? How much then they get tested, and how soon then they get tested? For instance, if cases then we come up yesterday, we test positive, the ones that then they take into quarantine, because as you say, the number increased from we took yesterday 1,661 to 2,051. We now, you know, that's a lot, and waiting they happen. How did they get tested? How fast? How soon did they get tested? That's the concern. But also, if the one that they already get to, if they all not only be tested, are they all going to be tested? The ones in quarantine that were primary or secondary contact based on the line listing that you have done. Additionally, now you get 3 categories of the cases. You get the suspected cases, you get the probable cases, and you get the positive cases. Now, of that 3 categories, how many suspected cases do we have? How many probable cases, if you have them at the moment? Obviously, the positives we know already based on the figures we get. Now, 307 people don't be tested positive, 222 of them actively in an isolation center. So, probable cases where we get, how many? Suspected cases, how many? The question.
Okay. Yes, okay, let's see. Yes.
Mr. Jamil, again, I ask, who do they manage their accounts? Now, EOC or the Finance Ministry? Another thing again, I want to ask, like I said, I kind of confused. The question directly to you. If, like, normally, if you can don't normally get the briefing, like what thing they happen around the coronavirus, because, like, I kind of be surprised. Issue that now, I don't care, Koinadogo and the medicine as well. You kind of confused, like, or you never know if it's never landed they happen. As a spokesperson, I'm from if you can normally get a briefing before the update.
Absolutely, and it gets a briefing, but you won't know everything that happens. I mean, it's normally the case. In fact, for we in Sierra Leone, I think we volunteer quite a lot. I listen to press briefings on a daily basis, even on the White House. The president you admire most, you see how dismissive he is of questions. I think we volunteer a lot here as experts. You know, even things where sometimes could be very sensitive, we always make sure we would get into them and provide responses. We do. You know, so it's standard. But also members say this is a health emergency, and we could also members say there are sensitivities around some of the issues. But what we know, we tell you. But what we don't know, we're very forthright enough to tell you we can't establish it. You know, I will never sit as a spokesperson and volunteer on something when they will think me competent. I will never do it. Just for the sake of satisfying a journalist, I will never do it. I don't think that's what a good PR should be. I don't think that's what a good public relations should be. On case 90, when we ask we tell you, what we know, they tell us, say we know. So we are not the kind of people who would say, let's volunteer because journalists want it. We'll never know. And also, make we also know some of the things get security sensitivities around them, and the security people also need them for check before they could come up with something will not come and mislead the general public. For make we able for sufficiently affect COVID-19, we think say one, we're going to be forthright. Two, we're going to make sure that people get relevant information for help them for fight the disease. But that doesn't mean we should volunteer more than we should. And I think it's the standard practice all over the world. And the reason why we bring experts are because we want for me people that speak to the respective pillars. I mean, that's a standard we have set for ourselves. But quite honestly, if I don't know anything, I will tell you. So yesterday, after the press conference, my team walked around, and indeed we were able to establish, say yes, donation don't come from Madagascar, but it was never initiated by the EOC. And the experts had never established that we need Madagascar organic for attend to cases. That is the fact. And that is the fact that, you know, and that's what we have to tell the Sierra Leonean people. If later on, the experts at the EOC, the one that were in charge of drugs, able to establish, say, this is something that could be used, of course we will establish it. And we will put it into the public domain. But we will never say to the Sierra Leonean people, yes, Madagascar organic don't come for use, for give people away in a treatment center, if it is not established by the one that we're competent for determining, say, it is good for use. We will never do it. I will never be a party to anything for orchestrating them kind of thing. Then it's totally misleading, and I think say it completely mischievous. But the moment the experts determine that this is something that we should use, as spokesperson, I'll be the first to lead it. But I'll never, unless that is established, I will not do it. So on security issues as well, yes. If something happened will relate to security, even today before me and my colleague became Harold, there was something about death cases. That's an issue we discussed, and we said this has to be investigated. Because until we get we wraps around things, you know, there is a reason why I'm official spokesman for COVID-19. And that there will never be a betrayal of that trust. And I think the Sierra Leonean people understand that, and I think say, on that basis they will get to operate. So yes, we get briefings, but yes, there are some things, if you're not mature enough for speak to them, we'll never speak to them. And that is why we are here, for jealously guard protocols. Yes, we want to satisfy journalists, we want to get to the business of public disclosures, but there are certain protocols and sensitivities that guide us as well, and we'll never breach those protocols.
We don't manage the accounts, that special account, that COVID account.
Okay,
Yes.
so no, I will answer that for the last time. The Ministry of Finance made public 2 accounts. Okay, media practitioners know about those accounts, and those accounts were established for the purpose of donations for COVID-19. And the name of the account is COVID-19 Response. So those accounts are opened for and on behalf of the people of Sierra Leone, whether it's cash donations, whether it's check donations. We don't say as an EOC, we could allow people to come and make symbolic donations, but every direct cash or check donation for going to their account then. And there is a process that I also explained yesterday, and you were in this room. Yeah. And I'm sure all of your colleagues were here. And I explained the process about how we access funds. I will not go over that again because all of your colleagues understood it. If you are the only person that did not understand it, I'm afraid. But I explained it. Next question.
Hold on. You know, the rule is you ask questions and we'll put 5 questions on the room and answer. We would not encourage people to do cross-examination in this room.
I
want to say something about the Madagascar COVID organism. My friend, are you listening?
That's what I think.
We must understand that there is a political dimension to that presentation. A country and a head of state presents a gift to another country. Madagascar says to Sierra Leone, we have this, whether it's drug, whatever, that we believe works. We are presenting, we are donating this to your country. Should the country say, no, we don't want? They cannot say we don't want. So that is the political side. The government accepted the donation, made arrangements to bring it into the country. That is one level. The other level is the use, and that's what has been explained, the process for the use. So in terms of accepting and bringing the material to the country, that's a government decision. It's a political decision. And it is not the EOC that will make that decision. When it has come now, the EOC and the experts have to determine whether it should be used and how it should be used. So let us understand that. The process of donation, accepting, bringing to the country, that's government, political. So let's separate it.
I'll just wrap up. Thanks, Doc. I'll just wrap up on this. When you open your account in a commercial bank, who manages your account?
Sir.
Well, now I see the point.
Yes.
Now I see the misconception.
Before you answer the question, there was another question by John on the 3 tiers of cases. That is suspected cases, probable cases, and then confirmed cases. I don't know if anybody would want to answer. Otherwise, okay.
Testing.
Yes, no, the 3 tiers of cases: suspected, probable, and confirmed. No, just the case, the definition of it.
I think the definition of these ones, a confirmed case is someone who has been tested positive for COVID-19. Here we check for the component we refer to as the antigen. A probable case is someone who may have two tests, one of which may show a positive result and the other is negative. So it's not conclusive. It does not tell us exactly that this is indeed COVID. A suspect, on the other hand, is someone who has features suggestive of COVID-19. The person may fit into what we refer to as a case definition. That's putting symptoms suggestive of COVID-19, cough, fever. Then we can say this person actually fits into that particular criteria. I will put all those symptoms together. So those are suspects. And these suspects are the people that we put in isolation centers. Every health facility in this country has an isolation center. Those hospitals. Go to Connaught Hospital, there is an isolation center. So when someone comes to see a doctor at Connaught Hospital, so based on the way the person presents, then the doctor will say, oh, this feature suggests COVID. And as a result, you should go to the isolation center. So asking for numbers on this one is difficult because it's highly dynamic. Some people might have even admitted now into the isolation centers at Connaught, at Ukuba Government Hospital. So it's dynamic. If we say we are going to capture it, it's very, very dynamic. And some people might have been tested and then removed from the isolation centers while others are going. Some people have been assessed. So this is the answer to this. I don't think it's something is confirmed. So for COVID cases that are confirmed, have been admitted in the treatment centers, referred to as COVID treatment centers, when they have severe illness, or in the community care centers when they have mild illness or they are asymptomatic. For probable, I think for now we have 8 cases that are probable. Whose results is not conclusive, waiting for that to be confirmed.
Okay, thank you. Yes?
Yes, Mr. Spokesman, I'm concerned with the area of the economy. How badly hit the economy has been. Is that the answer? Maybe we can have someone with the Minister of Finance.
Thank you. I could just speak to that briefly, not on the specifics, but looking at the nature and scope of the pandemic, this is something that has affected economies all over the world. For West African states, ECOWAS had projected growth of about 3.3%. Should this continue till June, it should come down to about 2%. And if we don't take the right steps, ECOWAS has warned that we might slip down to minus 2%. So that gives us an idea. So economies all over the world are affected, from America to Angola, from Sierra Leone to China. I mean, even the most advanced, even the most economically powerful, they are affected. And if you look at the our unique, if you look at our own local facts and circumstances, look at what's happened in Tombo, for example. People have been saying that we have been fishing, and now we had a 3 days lockdown. I mean, the fishing sector is an important sector. One of the areas that I'm aware may be keeping its head above water, for example, could be customs. And I know they seem to be, simmering very well. But the coronavirus has affected a lot of places economically. You are privy, I don't know if you were part of the interviews conducted with the CEO of Seacoach. Jaji was also talking about how that sector is also being affected severely. So it's something that affects every country all over the world. And I think the faster we are able to address this, the better for all of us. And I think it's an important thing. Thank you.
Okay, thank you very much. We have come to the close of today's.
Please, let me ask you for clarification. My question again is not about treatment or the medicine how it can be treated. I would suppose if a donation of a medicine is done with a response team will be in charge of it and will be able to give information of it. My question again is how much medicine was donated to Sierra Leone and who is in charge of it? I'm not actually asking again about its treatment. It's the quantity and who is in charge of it. Is the EOC in charge of it? Is the response team aware of it?
Okay.
That's my question, sir.
All right. Lama, I will just speak to this briefly, and I will get one of the experts on the medical practitioners to also perhaps speak to the medical side. We have our central medical stores in Sierra Leone. So once we receive medical equipment or drugs found on behalf of the people of Sierra Leone, the central medical stores should be in custody. So once the necessary details are transmitted to the EOC, it will be our pleasure to announce to Sierra Leoneans that this is what we have received. And I think that will be the point that will be very competent to speak about it. So we would also have some meetings around this today. So by the next time we'll have our updates by tomorrow, we'll have enough information to share around the Madagascar organic. Lama, you recall, you were the first person who asked me about case 90. And the very morning you asked me about case 90, I was forthright enough to say it's something that we would investigate. And I'm sure the following day when we came, or thereafter, we were able to speak to it, at least in bits and pieces. So on this one as well, once we have full details about the Madagascar organic, it will be our pleasure to put into the public domain. Dr. Sivali?
Yeah. Well, I think that has been well addressed. The central medical store will establish quantity and communicate to us. I think Mr. Conte also asked a question around who we test in quarantine. Everybody in quarantine will be tested. People in quarantine are people that are primary contacts of cases that have been confirmed. Our testing policy is dynamic and will evolve over time. We test people on the 14th day in quarantine. At some stage, we change that policy and say, in fact, let us test on the first day. We take samples as soon as you go to quarantine. In case there are positives, because the numbers are increasing in quarantine, in case there are positive, then we channel them to treatment center. If they are mild and asymptomatic, to community care centers. And we follow the rest of the people that are negative to determine those that will become positive in future. On the 14th day, people are discharged from quarantine. Having said that, I just want to conclude by thanking the healthcare workers. It is very challenging times for the health workforce. People are working day and night. Nurses, doctors, community health officers, laboratory technicians, the surveillance pillar is working, and it is quite involving. I just want to appreciate them and thank them for the commitment in supporting the response to COVID. Thank you.
Thank you very much, Dr. Sivali. On this note, I want to thank all those who are in the room, the subject matter experts, and those who have made it in the virtual world. I want to say thank you very much and stay safe. We'll see you tomorrow, same time at 11 a.m.
Thank you.